What is up, y'all? Welcome back. So we have some more questions. So medicine with AUNO, hit that subscribe button if you haven't yet to help me out. All right, so we have a 3-year-old boy now brought to the emergency room with severe headache, high fever, lethargy, malaise, and confusion. There's a history of multiple sinus infections. His temp is 104.2, and a diagnosis of bacterial meningitis is assumed, and lumbar puncture with lab analysis confirms the diagnosis. So which of the following vertebral levels is safest to perform this lumbar puncture? So where are we doing this lumbar puncture? Obviously it's in the low back. You're inserting the needle to go collect some CSF inside of the subarachnoid space. So which level safe is here? So we know young people, right, and children, the spinal cord is going to end around L3, and adults is going to end around L1, L2. I don't know why I have the answer highlighted, but we know we don't want to hit the spinal cord, so we know it's not T12, L1. We know it's not L1, L2, because that's still kind of close. L2, L3 is close too, so why don't we go a little farther down? But let's look at the spinal cord. So the lumbar sample is taken from the lumbar cistern, and it's the subarachnoid space below the spinal cord, and it's below, here's the conus medullaris, which is the terminating portion of the spinal cord at about L1, L2, as we said. And then we have the quada equina, horse's tail coming down with nerve roots from about L2 down to I believe it's S2. Yeah, the spinal cord ends at S2. The dural sac, the spinal cord ends at L1, L2. The dural sac ends at L2. The dural sac is basically, there's the CSF inside of that. So you don't want to go below S2, and you don't want to go above L2. And even here is kind of risky. So that's why we want to go into this space right here and go collect the CSF. Now, you also may go L3, L4, but that wasn't an answer choice. But L4, L5 is pretty safe. Here's the dura mater, as we said. That's going to end around S2, dural sac. Quada equina, subarachnoid space with the CSF, and the needle goes in here. And some people might be like, well, how do you know you're not going to hit one of these spinal nerves? That's a great question. I don't know the answer yet. But I'm assuming you kind of feel when you're in there and you don't just jab it in there. But maybe stuff starts spurting backwards too. So that is the end of that question. So next question, same case. Everything's the same except they're asking what following external landmark is most reliable to determine the L4 vertebral spine. Why do we need to know that? Before we show that, we want to know where to stick this this needle. So what external landmark will show us where to stick the needle? So here's an X-ray, y'all. Here's L5, here's L4, and you can see at the top of this, it lines up nicely with the spinous process of L4 and the space between the intervertebral space L4, L5. A little bit above that. So, are we going to look at the highest point of iliac crest? Maybe so. Inferior angles of the scapula, that would be way up here. Probably not a good spot to look. The lowest pair of ribs bilaterally, nah, that's probably too high. The sacrohiatus, don't even know what that is, but probably too low, somewhere down here. And posterior inferior iliac spines, that's going to be right here, the dimples at our lower back, so that's a little too low. So here's the L4, L5, and here is about where we're looking. L4 vertebral spine is the highest point of iliac crest. This is the same thing, but on a CT scan and an MRI scan. We can see the highest point of the iliac crest is coming right at the L4, L5 intervertebral space. And really on this here, it's a little higher than that. It's right at the spinous process. And it's called Tuffier line. Don't know how you say that, but it's basically the most superior portion of the iliac crest that can mark the L4 for lumbar puncture. Iliac crest is palpated and medially traced toward the vertebral column, right? So you You can see that nicely right here. And there it is. It looks just like it on this x-ray. So pretty good in most people, right? Anatomy's the same as far as like this goes. There's a lot of anatomical variants of other things, but this is pretty good to figure this out. So it's a transverse line connecting the tops of the iliac crest, and it intersects the spine at L4 spinous process or L4, L5 or intervertebral space. And that's what you see, L4 spinous process, or sometimes it's in the space between. So it's pretty good. Landmark. And that's the end of this. That question was easy. Not the end of the video though. One more. 39-year-old. He's coming in with severe neck pain, whiplash injury, boom. Right, extension of the cervical spine. Is that right, y'all? Comment for me. Again, I'm learning this, okay? We're learning this. I don't know this stuff. You're like, why am I watching this video then? Because we're learning it together. So he was hit from behind, right? Hyperextension of the neck. Put in a cervical collar, lidocaine administered for pain control, anesthetic. Had some imaging done showing trauma to a ligament on the anterior surface of the C-spine vertebral bodies. This is a great one here, so stay for this. Which of the following ligaments was most likely disrupted? So, is it anterior longitudinal ligament? Well, let's find these ligaments on here, and then we're going to find them on here. So, anterior longitudinal ligament is at the very front of the vertebral bodies, okay? And it just runs here. There it is. So they're showing the trauma was on the ligament at the anterior surface of the vertebral body. So A might be correct. Ligamentum flavum, that's going to be more posterior. That's going to connect the laminae, I think, of these, of the vertebral, whatever this is called, vertebrae, the laminae of that. So the yellow stuff, right? Ligamentum flavum. Transverse cervical ligament, I don't think they put it on this picture. Nuchal ligament is right here, this big thing here, nuchal ligament in the back. So that's not close, that's the opposite of the anterior surface of the vertebral body. And posterior longitudinal ligament is seen right behind the vertebral bodies, not anterior but posterior surface of the vertebral bodies. So it's kind of the opposite of anterior longitudinal ligament. So MRI scan, y'all. Now here we show anterior longitudinal ligament as seen anteriorly along here. Okay, that is on the anterior surface of C-spine. Ligamentum flavum is going to be back here. So right behind the spinal cord, or right in front of the spinous processes, right, is the ligamentum flavum. Remember, if this is hypertrophied, you can have some nerve root injury from a previous lecture we did, or video. What else? Yeah, I don't think I would call these lectures. Transverse cervical ligament. Oh yeah, we're going to get to that. That's not even in the spine. I forgot. Nuchal ligament. That's right back here, as seen here. Right, in green. And posterior longitudinal ligament is in pink. It's the exact opposite of the anterior longitudinal ligament. So here again is just a good picture showing these, the anterior column, middle column, posterior column. 4 is our supraspinous ligament, which isn't even an option, but that's in the back. 2 is interspinous ligament, again not an option, but between the spinous processes, interspinous. 1 is our ligamentum flavum connecting the lamina, as we said right here. It connects these lamina, and you can see it here as well. That's everything. This whole thing was just to show the ligamentum flavum. This is a good picture of that. So, transverse cervical ligament. This one is not in the cervical spine. This is the cardinal ligaments. They're also called the lateral transverse cervical or Mackenrott's ligaments, and these are actually in female anatomy, and they're situated along the inferior border of the broad ligament and house the uterine artery and uterine vein. So here's the cervix, bladder, rectum sacrum, so this is anterior, posterior. And you see the transverse cervical ligament coming off here, also called lateral cervical ligament. So it's basically attaching here. Okay, so that's not her answer, of course. And here is a picture showing these veins, just like they say. It houses uterine artery and uterine vein. So you can see the cardinal ligament houses right here, artery vein. Okay, and cardinal ligament. So, and this is the, well, yeah, you can go, this is an axial slice, right? Or a transverse slice. And this is a coronal or frontal slice. So interlongitudinal ligaments in blue, and that is our correct answer, y'all. And we have made it to the end of the show. So make sure to go subscribe, show some love, y'all. And we are out. Thanks for watching. Have a great week. Stay strong. Get on your purpose.